Understanding colon cancer symptoms, a must-watch. I never thought stomach cramps and a little blood could turn my whole world upside down, whispers Michael Torres, a 43-year-old construction worker from Phoenix, Arizona. I always blamed it on my spicy food habit or stress from work. By the time I finally saw a doctor, my colon cancer had already spread. Michael's story reflects a terrifying reality. Over 53,000 Americans are expected to die from colorectal cancer this year alone, making it the second deadliest cancer in the United States. Even more alarming, recent studies show a 2% annual increase in colon cancer cases among adults under 50, a trend that's sending shockwaves through the medical community. 6 months before his diagnosis, Michael started experiencing occasional cramping and bloating after meals. Like many Americans, he dismissed these early warning signs as simple digestive issues. "I'd take some antacids and go about my day," he recalls. "Sometimes I'd notice a little blood when using the bathroom, but I convinced myself it was just hemorrhoids." What Michael didn't realize was that his body was sending crucial distress signals. Dr. James Rodriguez, the gastroenterologist who eventually diagnosed Michael, explains, "The challenge with colon cancer is that its early symptoms often mimic common digestive problems. This makes it crucial to understand when these symptoms warrant immediate medical attention." When Michael finally visited his primary care physician, his symptoms had evolved to include unexplained weight loss, constant fatigue, and more frequent bleeding. His doctor initially suspected several possible conditions: irritable bowel syndrome, or IBS, which can cause similar cramping and bowel changes; inflammatory bowel disease, or IBD, known for causing bleeding and abdominal pain; celiac disease, which often presents with digestive issues and fatigue; hemorrhoids, a common cause of rectal bleeding, or even a simple bacterial infection. To rule out these possibilities, Michael underwent a series of tests. First, a complete blood count revealed severe anemia, explaining his fatigue. Stool tests came back positive for occult blood, raising immediate red flags. However, the defining moment came during his colonoscopy, which revealed a large tumor in his ascending colon. The previous tests I'd done at walk-in clinics, just basic blood work and physical exams, hadn't caught it, Michael explains. "They kept treating me for hemorrhoids and telling me to modify my diet. If I'd known the importance of getting a colonoscopy when symptoms persist, things might have been different." Further imaging revealed that Michael's cancer had reached stage 3, having spread to nearby lymph nodes. The reason for his delayed diagnosis became clear. Like many patients, he had developed cancer on the right side of his colon, where symptoms tend to be more subtle and bleeding less obvious because of the distance the blood travels through the digestive system. Looking back, Michael identified several risk factors he wishes he'd known about earlier. His family history included an aunt who had died from colon cancer at 55, and his diet had been high in processed meats and low in fiber for years. Additionally, his sedentary lifestyle and moderate obesity had increased his risk. After 6 months of aggressive treatment, including surgery and chemotherapy, Michael received the news he'd been praying for. His cancer was in remission. "The journey was brutal," he admits, "but it taught me the importance of listening to your body and taking action early." Today, Michael is cancer-free and has become an advocate for early detection. His message is clear: don't ignore persistent digestive symptoms, especially if they last more than a few weeks. Know your family history. Get regular screenings starting at 45 or earlier if you have risk factors. "The most important thing I've learned," Michael emphasizes, "is that colon cancer is highly treatable when caught early. My story could have had a very different ending if I'd waited just a few more months. Don't let fear or embarrassment stop you from getting checked out. It could save your life." For viewers watching this video, remember these prevention steps. Maintain a healthy diet rich in fiber, limit processed meats, exercise regularly, maintain a healthy weight, avoid excessive alcohol, and don't smoke. Most importantly, never ignore persistent changes in your bowel habits or unexplained symptoms, no matter your age.